Hi, this is Dr. David Ramaley at Seattle Natural Health. Okay, so today I'm talking about concussions. And most importantly, there's three things. One, how do you know you've had a concussion? Two, what you can do about it. And three, what we here at Seattle Natural Health can help you with as well. So I hear about concussions a lot from all the professional athletes who have had these head traumas and ultimately end up with poor memory loss, maybe dementia, and some have even taken their lives. Well, maybe not to that extreme. This can happen to any one of us. And typically we see this in sports injuries. You may have a child who was playing soccer who got hit in the head. And what we typically see here is they start developing headaches, migraines, light sensitivity, then they have to stay out of school for a while. And as adults, while we might not be injured so much in sports injuries, what we do see are car accidents and work-related injuries where we can get a concussion as well. So in the case of a head trauma or in a motor vehicle accident, when you get whiplash, what actually happens is we get what's called a hyperflexion or hyperextension injury, where the head goes forward and backward or vice versa. And during that traumatic episode, the ligaments and the muscles are all stretched, and that creates a lot of injury to the soft tissues. Now that may not be exactly to the brain, but what happens even with neck injuries, that affects the proprioception up to the brain, and the brain doesn't function as well. Now a common question I always ask patients is when they come in, what was the last thing you remembered before the accident? And then what was the first thing that you remembered after that? Because typically people say, hey, I wasn't knocked unconscious, I was fine. But if you ask them the question, they're going to say, I remember getting hit from behind. The next thing I remembered, someone was knocking on the window of the car and I was at a complete stop. And there's a lapse of memory there, and that's a sign of a traumatic brain injury. It's really good to have an MRI or a CT scan done to make sure you don't have a brain bleed or what would be called a hematoma up on the skull, which would be very serious. But once that's ruled out, conventional treatment doesn't really have a whole lot to offer for concussion. So according to the Center for Disease Control's website, they basically recommend after concussion is rest for 2 to 4 weeks, and then if you're not feeling any better after that, to go see a neurologist. Then typically once you've seen a neurologist, you'll be told to come back in a month if you're not feeling any better, and then come back in another month if you're not feeling any better, but no one's really talking about any kind of treatment. So this is not to criticize neurologists or conventional treatment, but there's a whole nother arena of healthcare that can help people speed up the recovery from a concussion. Well, I do agree you need rest, and I absolutely think that's the first thing you should do for the first 2 to 3 days. You want to be sleeping as much as you possibly can, take naps. All of that is so important. But what you can do right away is one of my favorite nutrients that you can take, and it's been well studied for concussion, is magnesium. And I'm going to suggest that you take magnesium threonate, that's Threonate. It's a magnesium that helps get into the brain, and doing 150 milligrams twice a day. Or you can take magnesium glycinate, Glycinate, and I would do 300 milligrams at least 4 times a day. Typically if you get too much magnesium, you'll get some loose stools. And once you've reached that part, you can actually back off from that a little bit. But typically after a brain trauma, you can take a lot of magnesium, and that helps the brain to heal quickly. What also happens when you have a brain trauma, you actually have too much calcium flow into the nerve cell, and that's what creates that inflammation, irritability. And magnesium helps pull some of that calcium out. The next supplement I really like is something called DHA. That's D as in dog, HA. So it's not DHEA like we see in the hormone, but DHA, which we find in fish oil. And I would recommend 500 milligrams twice a day because that helps lower inflammation in the brain to heal. The other one is curcumin, or what's commonly called turmeric, and to do 400 milligrams twice a day because it's a great anti-inflammatory to the brain. The other nutrient that tends to be overlooked is lithium orotate, O-R-O-T-A-T-E. Now this isn't like the lithium that you see as a prescription, this is just actually a supplement. And I'm going to recommend 10 milligrams twice a day because that helps the brain to heal. The foods that you want to avoid are MSG and sugar because they only create more inflammation in the brain. Now if you really want to do the next step dietarily, the one thing I recommend is doing a ketogenic diet, which basically is doing a very high-fat diet. I'm not going to go into the details of that, but a ketogenic diet produces things called ketones that the brain preferentially loves. and the ketones can definitely help the brain to heal. So while you're resting, and for the first 1 or 2 weeks after that trauma, you want to avoid blue light. So that would be things like cell phone screens, computer screens, tablets, LED lights, fluorescent lights. That blue light really stimulates the brain and creates more inflammation. So limit your screen time. Now, if you actually have to get on a computer or cell phone to use and look at that screen, I'm going to highly recommend using some blue blocking glasses. Now, these are like gaming glasses, and they really block out all of that blue light. So what I think you want to do is avoid electromagnetic radiation, which is basically your cell phones, your tablets, Wi-Fi on your computer. Any of those actually really accentuate, again, the inflammation in the brain. So you want to limit that amount of time that you're exposed to it. The one thing I really don't want to do is you now see those AirPods that use Bluetooth to put into your ears. That will definitely affect your brain, concussion or not. It's going to create a lot of inflammation and dramatically slow down the progress in healing from a concussion. So after resting for several days, I recommend going outside if you're not too light sensitive at that point. Natural light, not blue light, but natural light actually helps sync your brain to the Earth's rhythm. And natural light actually acts as an anti-inflammatory to your brain and your overall body. So the more you can get outside without sunglasses, the better. You can just sit in some shade and look at trees. That definitely helps with the brain and the overall healing. So here at Seattle Natural Health, we offer more of a functional approach. One of the first things that we would do would be a complete neurological evaluation. As I mentioned before, you want to be sure to rule out any real major brain trauma. But once that's been ruled out, there's a whole host of things that we can do. The first is we can do some very gentle chiropractic manipulation. And what I use is a machine right here called an adjuster, and it just gives a very light tap like this. And this works really well because after a trauma, most people are really inflamed and they're very sore, and this is a nice gentle approach to get their joints and muscles moving again. So I'm not lying down right now because I'm bored with myself or I need to take a nap, which maybe I should be doing. But I want to show you about another therapy that we use called craniosacral therapy. And Dr. McQuaig is with me here today, and she is the one who specializes in this. And the whole point of this is after a concussion, the cranial bones don't move very well. And once they stop moving, it actually creates more inflammation and less energy to the brain. So it's not like a typical joint that we'd think of like in our neck or back, because it doesn't have that kind of movement, but it moves very gently. But what it does is it actually pumps something called cerebral spinal fluid. That's the stuff that goes up and down your spine and actually lubricates the nerves. And without that, you're going to feel a lot more tired, and you're also going to not heal as well. So as she's holding my skull here, she's actually feeling how the joints are moving and restoring normal motion. And it is really relaxing. So the next thing we would do would be using an instrument called the percussor. And the percussor helps release the fascia. And the fascia looks like plastic wrap and surrounds our whole body. And after trauma, that fascia will get glued to the muscle and it creates chronic pain and restriction. So using this instrument, we apply this to the body and it just gives a very light vibration. And we can actually feel the fascia start to release, which will dramatically increase the healing process. Another therapy we use is something called trigger point injections. And this is a very cool therapy because we inject a little bit of something called arnica, which is a homeopathic, or Traumil is the other name for it, and a little bit of lidocaine. And generally we do these injections into just the muscle or even into the skin, which is very similar to acupuncture. And what that does is it creates a healing response. So it lowers the inflammation and helps the nerve to calm down. And we find we do this to the upper part of the neck, which generally is a fairly painless procedure. People don't really mind it that much. It really helps decrease the pain. The next procedure we'd be using is something called a cold laser. And what this does, it emits a light without any heat, and it actually helps the muscles and the nerves to start talking to each other. But more importantly, when we use this on the brain, it helps increase the energy of the brain, and it actually decreases the inflammation. So we use this all the time on anybody who's ever had any kind of concussions. And there's been great research using cold laser therapy for concussions. So how we'd use this on someone with a concussion is we actually hold the laser right up to the skull, and we would actually hold it here, right like this. And we have different settings on here for different parts of the brain as well. So now I'm doing the frontal cortex, so we would hold this here for about 30 seconds, and then we'd switch it over to the other side. And then as time goes on, we move it to different parts of the brain, maybe it'd be called the parietal lobe or the temporal lobe. This would generally take several minutes. And then once we're done with that, that actually helps increase the energy to the brain. Then one of the last things we do would be doing a dietary and lifestyle intervention and looking at things which I had briefly mentioned before, what you can do nutritionally and what you can do in your own life to help with the concussion and the healing process. Again, I'm Dr. David Ramaley at Seattle Natural Health. Have a great day.